we need to raise more awareness. Stigma around this disease, like dementia, is a progressive disorder. This is a life-ending disease. And that means that the day-to-day care is crucial when you're living with dementia. And this is really where our system is completely fragmented. On average, it takes about 21 to 28 months to be diagnosed. That's just the diagnosis. And then there's all of the follow-up pieces around follow-up appointments, sometimes no appointments for 9 months to a year. After that first diagnosis, can you imagine being told you have this disease and then not having any follow-ups that would really support how your care and trajectory might look? We don't think about how do we support the person's quality of life from a systems level. And so we're doing a huge disservice to people who are living with this disease. And eventually, you have caregivers who are burning out. It's an enormous economic cost. It's costing us billions in the health system, both directly but also indirectly. And again, coming back to being a woman and a person of color, it is primarily women who are caregivers. So they start stepping away from their careers and their roles because their caregiving responsibilities can go up to 40 hours a week. They're not really being trained and supported well in being able to do that. And so at the Brainwell Institute, we have one mission and mandate. It is to get coordinated dementia care into our system. So when we come to thinking about co-design, it comes back to recognizing what value that lived experience is. We work very closely with people living with lived experience of dementia, caregivers or living with dementia, but we also work with diverse communities because their voices are not often at these tables influencing some of the trajectories and ways in which the system needs to change. And the way we approach it is you as a community have expertise. You recognize and know the cultural needs, you recognize the linguistic needs, and you know how best to support each other. What we bring to the table is an understanding about dementia and about the system. That's our expertise, but it needs to be paired with your expertise. And then we support the community to be able to build that capacity in taking that dementia understanding and then implementing it and using it in their systems and within their communities